Charlotte, thank you. Well, joining us now, junior doctor Ben White, who's one of the leading voices in the campaign against the new contract. Very good morning to you. Just picking up on what Charlotte's been talking about, there has been an enormous amount of sympathy for the junior doctors, but I wonder whether you feel that that is going to be quite severely damaged if junior doctors tomorrow do not provide emergency cover.
Well, I think it's important to remember that we have consultants providing the emergency cover. Whilst if you get unwell, it's really important to go to hospital. That would be the main point.
Yeah, but of course, junior doctors are a huge part of our A&E cover, you know, providing emergency care. You know, if you're a mum this morning with a child with asthma, for instance, and you think, goodness me, what happens if something happens
well,
tomorrow?
There's a woman here who's tweeted us, I'm waiting for possibly life-saving surgery. It's been postponed. Maybe I'll be okay. Maybe the extra time will harm me. It's scary. There are lots of people in this position, and, you know, I know lots of junior doctors. I've had huge sympathy. I feel very uneasy as someone who's been supportive of you, like many, about this next step being a step too far.
If I'd have had an operation cancelled twice as a result of these strikes, I'd be very annoyed. Or worse, you know, I suppose there is a chance that I could have been harmed as a result of having operation cancelled. And I would say, I think we're sorry for that, for those people that have had, that have been put in that position. What I would say is, we feel that this is not just a decision for now and for this strike, but it's for the future of our NHS and for our patients, and that's why we've taken the decision to do this. Not because nothing to do with the pay and Saturdays, which is what people have talked about. I already worked Saturdays and I never asked for a pay rise, so really what this is about is the future of our health service.
You feel like you've been pushed right to the edge, don't you?
Absolutely,
and you've made decisions about your own life within the NHS.
So I've taken the decision, well, I will do so today, that I'm resigning as a training doctor to focus on a legal campaign, so legal proceedings to fight the contract, basically to fight on behalf of patients and fight for the future of the NHS. And I feel that I've got an obligation to do that on behalf of my patients.
I mean, OK, so let's articulate for our viewers what would drive a hard-working, dedicated young junior doctor to give up. It's effectively what you're doing for this cause. Why has it come to this?
That's a really good question. I think we feel like we've been backed into a corner, really, and there's not a lot of sense coming out from the government side of things at the moment. We all feel that it's been a long sort of 6 months. I think we really need to, we have to put patients first, and if we can see that at the moment the understaffing and the underfunding that's taking place in the NHS, I mean, an A&E had to call in the military the other day to staff it. You know, we had, in my hospital, we had more admissions in 24 hours than we've ever had before in East London. You know, this isn't being listened to. We have to look to the future, I think.
You saw Jeremy Hunt, didn't you, personally? You spoke to him.
Yeah.
Tell me about your encounter with him.
Well, I think I sat with a colleague. We spoke to him for about an hour in his office at the Department of Health.
And?
Well, it wasn't particularly productive, in my view. I felt that we made a lot of points, I think, hopefully very passionately, and I don't think they were really listened to.
This is, I mean, junior doctors resigning, as you just have, is a nightmare scenario for the Health Secretary and for the NHS. And, you know, nobody wants to see doctors leaving the National Health Service, but also the end of presumably hopes and dreams that you've had for years. I mean, that's a huge decision to make, especially as you have already said you want to put patients first. Does it help?
I think at the moment we have to think, what are we going to do to sort this situation out? And one of the things I know is we've set up a company with 5 junior doctors called Justice for Health, and we're taking these legal proceedings. We've got Bindmans, one of the leading public law specialists in this country, and they're fighting our corner. And honestly, they're fighting for patients and fighting for the future of the NHS. So I don't feel like there's anything better I can do for my patients at the moment in the context of what's going on.
OK, final question. When you go out on strike, if this isn't resolved, and you make history as the first ever doctors in this country to do what you're going to do, I mean, there's got to be a huge sense of guilt, hasn't there? And a sense amongst many of you as, are we doing the right thing here? If people die, and it can be said it was because junior doctors were not at their posts, how will you feel personally?
I think if anything like that did happen, there'd need to be a normal kind of review process. It'd be very, very sad if anything like that happened. I think when we have to go on strike, we all feel enormous sense of regret, and it's definitely not something we'd want to do. But we need to look into how that happened, and I don't know. I mean, I wouldn't want to comment on individual.
I mean, to put it in perspective, this is just a viewer who's tweeted this. Had to take a trip to A&E the other week. The staff were running around like headless chickens as they were so understaffed. Listened to a couple of junior doctors talking about their day. They'd been working since 7:45 a.m. They were still working at 9:45 p.m. with no sign of being able to go home. Those poor doctors cannot be in the right frame of mind to treat people. And if they made a mistake, who would be to blame? I mean, that's a powerful, I would say, supportive message for what you've been going through.
I think any viewers watching you, talk about the fact that you're handing in your notice as a junior doctor, is going to see what an effect it's had on you. It's clearly a time of heightened emotion for you, and there's a lot.
But that's quite something. I mean, to have a junior doctor resigning live on air. If you're Jeremy Hunt, you're watching this. This should not be happening in this country. It should not be happening to our health service. This is critical.
So, Ben White, I know we're going to talk to you a little bit later on. For now, thanks very much indeed.
Well, Ben's still with us, and former Junior Health Minister Edwina Currie joins us also from Derbyshire. Ben, let me just get you to clarify once again, for those who missed what happened earlier, why conditions are so bad now that you feel compelled to resign as a junior doctor?
Well, we've been through a period of the last 5 or 6 years that the sort of chronic underfunding of the NHS, which the King's Fund have written extensively on and spoken about. At the moment, we have a situation where in an accident and emergency, one doctor might routinely be doing 2 doctors' work, and that's not safe for patients. I think that's got lost in a lot of the other debate that's going on at the moment.
I mean, I read this out earlier. I think it's worth repeating. This is Liz Hicks, just a viewer. I took a trip to A&E the other week. The staff were running around like headless chickens. A couple of doctors I heard talking about their day. They've been there since 7:45 a.m., still working at 9:45 p.m. No sign of being able to go home. Those poor doctors cannot be in the right frame of mind to treat people. If they did make a mistake, who would be blamed? They would. I mean, this is, I think, the view of many people are sympathetic. Will they be, though, if you go out on this new strike, which would be unprecedented with no emergency cover?
Well, I don't think we know for sure. That would be for the public to decide. But what we have to remember is why we're doing this. We have to think long term, that we need I think the public still want an NHS in this country. And I think that if we're in a situation where we're chronically underfunding the NHS and we can't provide doctors and nurses on the wards, then I don't know what we have.
Let's talk to Edwina Currie, former Government Health Minister. Very good morning to you, Edwina. Well, it's not going to help, is it, if junior doctors feel that they're in a position where they actually have to give up their jobs because they're so desperate over this new contract?
Well, Dr. Ben White has clearly decided that he wants a future career as a trade union official, and I wish him well with that. It's got nothing whatever to do with the way that the NHS needs our doctors. I mean, he's talking about wards tomorrow not having doctors on. That's because they're going to be on strike. Nobody here has mentioned the patients yet. It's actually very important for the patients that the doctors, all of them, the juniors as well as the consultants, should be available, should be at work. As for working too many hours of overtime, that's exactly what the contract, the new contract, is going to tackle. It's going to spread the number of hours over 7 days a week, including Saturdays, so that we can have some emergency care, so that we can have good normal care right through the week. And I think most patients want to see that happening. And it's also going to ensure that the amount of overtime that people are working actually comes down. The basic salary is going up, the number of hours of overtime will come down. Most people can understand that. I can't quite figure out why the doctors are finding it so difficult to grasp.
Ben White, your chance to respond to Edwina Currie.
I think one of the difficulties for MPs is the briefings that have been sent out, I think, don't actually include the facts. So how are you supposed to make up your mind, really? I think with the situation we have at the moment, we're going to have 5 days worth of the doctors. We're already not staffing 5 days properly, and we're going to move them, we're going to stretch them over 7 days. And that, I mean, that can't be safe.
Edwina?
Well, with respect, first of all, I'm not a member of Parliament. I haven't been a member of Parliament for 18 years, so you get your facts right, Doctor, beg your pardon. And secondly, we really need to have a proper 7-day NHS, and the government is absolutely right about this, and I think most of the patients feel that this is right. And it's not just a question of emergency care. Sitting in my kitchen here is my husband. We were told last month that he has to have cataract operations. So he joins a waiting list of a large number, thousands of people who need cataract operations. People are waiting for hip operations. There are a whole range of operations and surgery and other kinds of treatment that have had to be postponed because doctors have decided that their pay is more important.
OK, let me jump in on behalf of Dr Whitehead, because, the truth is, we don't know what the sharp end is, most of us, in these hospitals for junior doctors. I happen to know a couple of junior doctors. There's one in my family. They are unbelievably stressed, incredibly overworked. The story I told earlier that was sent to us, very indicative of what is actually going on the ground. Do we really want the NHS to be full of doctors who are exhausted, who are stressed out, who want to quit, who want to leave the country? Do we want that? And if we don't, isn't it the right thing now for this government to give a little bit and give them what they believe they need to make it safer for patients?
Oh, I see. So if we pay the doctors more, they will be less stressed? They're the best paid staff in the NHS. And doctors, remember that we help to pay for all their training. They're heavily subsidised in their training, and they don't have to pay it back. Dr Ben White, leaving the profession, does not have to pay back the many, many thousands of pounds that taxpayers, including pensioners, have had to pay for this. We need our doctors. We have more doctors. We have more nurses. A lot more money has gone into the NHS.
Okay.
Now, when I was a minister, we had 30 billion pounds that we spent, and it's now 140 billion. A lot more money has gone in. But we can expect our doctors, please, to think about the patients first and
Dr.
to get
White,
back to work.
Just a final response.
Yeah, and this is all about patient safety. It's the reason that we're doing this. So I think it's really important that the point that you make about patients, they might not get their cataract operation. We really regret that might happen. And honestly, none of us wanted to take this decision in the first place. But what you've got to look at is we never asked for a pay rise. So what we need is more doctors. We don't need more pay.
All right, Dr Ben White, thanks very much indeed. Edwina Currie, thank you for your time as well. Well, tomorrow is when that strike is due to take place.
Emotive, yeah, because I think this is that critical point when people may lose their lives, and that's going to change the tone of this debate, and I think the emotions will run very high.
Lorraine's going to be here at 8:30. Morning, Lorraine.
Good morning to you. Very sad it's come to this, hasn't it? Coming up after past. After getting 4 yeses, Britain's Got Talent star Balance Unity is going to be showing us some moves.
Cleaning your teeth is just something you do, right? You can do it with your